Moving on, we have next speaker for the day. There are dreamers and there are planners. The planners make their dreams come true. Life is challenging. There is a lot calling for the attention. Subsequently, we get distracted with a bright, shiny object if you don't stay focused on being present and bringing our dreams into the reality. We have a passionate learner, Dr. T.V. Narayan. Sir is an oral pathologist with a fellow and diplomate of the ICOI, co-founder and co-director of the ITI Study Club Bangalore and the Implant and Aesthetic Academy India, member of the editorial board of Quintessence India Journal, faculty on Days and Dental XP's MOI course. He has many publications in the international and national journal, both on pathology and implantology. He has lectured widely at national and international conference on pathology and implant dentistry. I welcome you, sir. Platform is all yours.
Thank you, Dr. Soumya. I will just start sharing my screen. All right. Thank you once again, Dr. Soumya, and thank you for having me here. It's indeed a pleasure to speak to students who are stepping into the profession, in the sense that they're going to make that transition from being dental students to being our professional colleagues. And it gives me great pleasure to speak about oral pathology, which was my chosen specialty. And before anything else, let me make this disclaimer that oral pathology is something for somebody who enjoys the subject and only for them. So I'm not selling oral pathology to all of you, right? My aim here is to talk a little bit about what the role of an oral pathologist is, and to tell you that it's far beyond just sitting in a dental college and becoming a teacher in a dental college, because then you will find that the attrition is just so much for you to take, that all that will be left is a very bitter end to your whole dream of being an oral pathologist. So the way forward, as I see it, and the way up, as it is in pathology, is only if you are able to, first of all, break that mindset that oral pathology is a non-clinical subject. What you need to understand right at the outset is that the clinical bearing of what you say as a pathologist is far outreaching what you can do as a general dentist, say. Doing a simple restoration like Dr. Roderick is performing, and Dr. Nambiar said, anybody can do a regular dental restoration. Anybody can do an extraction once you've got your PDS degree. What you cannot do is, and you definitely cannot, be in a position to make a pronouncement which will dictate what happens to that patient's future, because the inherent question that any oral surgeon or any kind of surgeon, and I have a private practice of oral pathology for the last 25 years. Since 1996, I've been a teacher. I taught for all of 17 years before I quit the practice. Before I quit university teaching. But I still do run a private practice of pathology, and that's 25 years old. And let me tell you this, be it from a maxillofacial surgeon, an ENT surgeon, or just a general oncosurgeon, the inherent question in each specimen that comes to me is, what do I do next? And you understand the power that you have in the words that you write when you write your diagnosis and sign it out. And that is what that practitioner, that clinician is going to do next with the patient. And that is the power of pathology. So that is something that you cannot wield, be it as an orthodontist, a prosthodontist, or even as a maxillofacial surgeon, because what the maxillofacial surgeon does eventually is what I tell him to do, because that is the inherent question in his request for a biopsy. Um, Again, we have a huge burden of oral disease. 30 to 40% of surgical pathology specimen in all general pathology settings come from the head and neck, right? And more than 30% of India's general cancer burden is oral cancer. That means that there is just a lot of disease out there, and there is somebody who needs to go out there to diagnose. Unfortunately, what has happened and this is something that you people have the power to change if you do have the inclination to pursue pathology as a profession. Unfortunately, what has happened is that it has become almost a kind of granted feeling that oral pathology means that you are a non-clinician, right? Which is absolutely false. So if you are able to impress upon yourself to start with about the clinical impact that you have, and you're able to then pass on that impact to your colleagues in the ENT and head and neck specialties, you will be able to actually make a big difference because of the impact of. And I will tell you this: there are very few general pathologists who are able to accurately not just diagnose, but even prognosticate on oral and maxillofacial lesions, because they tend to look at things in a very different manner. Just for instance, a couple of days ago, I received a specimen from Pune, and it has been, this is gingival biopsy that was done by a very prominent periodontist in Pune. And the general pathologists and two general pathologists reports over there is that it is just a general, chronic inflammatory process in the gingiva, and it is consistent with the gingival epilus. When I look at it, I see a chronic granular metastasis, and my suspicion is that the patient is suffering from sarcoidosis. So you understand that as somebody who's it's almost a super specialization in dentistry. No other dentist will be able to get down and make these sort of nuances. The kind of nuances that are necessary for making these kind of diagnoses. Those skills are not possessed by general pathologists, nor by general dentists, nor by orthodontists, nor by maxillofacial surgeons, nor pathologists, nor prosthodontists. So you need to understand that this is something that you will do only if you have a love for it. If you do not, I will not encourage any one of you to take oral pathology just for the sake of doing your MDS. Do not make don't make that mistake saying that I want a degree which says MDS and then get into pathology. I'm a pathologist. I also practice implants. I practice a very high level of aesthetic dentistry. I practice full mouth rehabs as a specialization. So there is a lot of things that I do. There are multiple hats that I wear. So that's another thing that you need to understand, that as a pathologist, you have the ability to do many more things. But as anything else, you do not have the ability to practice pathology the same way. And like you can see over here, we have a very high prevalence in our population. 5% is a huge number of leukoplakia, as is 6% of oral mucous fibrosis, and almost every second patient that you get to see in your every two patients out of 100 has got a lichen planus. So there is a lot of burden of oral disease that needs to be diagnosed and treated, and you have the ability to do both. So as an oral pathologist, your major role should be, or my focus in my practice in oral pathology has been on surgical pathology, and it has been about diagnosis. My forte, my strength has always been diagnosis of oral maxillofacial surgical pathology specimen. But that does not the only thing here, right? You can have a specialized oral path clinic setup where you can do clinical diagnoses along with your surgical pathology services. You can institute tobacco intervention protocols for which you would need, of course, to go to get trained for. And there are several centers like NIMHANS in Bangalore which will be able to help you train in tobacco intervention protocols. Again, the service that you will provide is not merely the satisfaction that you will get out of it is because of the amount of public service that gets done. Don't look at oral pathology if the aim in your this thing is only about bread, butter, and jam. But think about the gratitude that you will get out of from people whose lives have changed because you made the right call and got them treated in the right manner. You look at that as the bacon, and it will make a big difference. For the bread, butter, and jam, you always have the ability to start a dental practice and do dentistry as it is, and you can take that to the maximum levels that you want. So there is really no stopping you over there. Academia and research. Now the possibilities are really endless. You can do genetics to molecular biology to epidemiology. There is really a huge, scope for research. Unfortunately, not so much in our country. We produce a lot of pathologists. We have a lot of seats in oral pathology. We produce a lot of oral pathologists. Unfortunately, we do not have the right kind of atmosphere or the infrastructure for really good research. But that can change, and it should change because we have very, very good people at the helm of the science in several departments of oral pathology across India. As far as gainful employment goes, you do not have to think of a college job as your only hope. You can be employed as a consultant, right? You can work in a laboratory as a laboratory administrator, quality manager in diagnostic services, as an oncohistopathologist in cancer hospitals. And I'll tell you about cancer hospitals that are offering fellowships in oncohistopathology so that you can you can even be kind of inculcated in the same centers. You have several oral cancer centers where you could gain employment. Dermatology clinics are always looking for help with oral lesions because there is so much oral involvement in dermat cases. And unfortunately, the dermatologists end up not focusing so much on the oral lesions, and we end up seeing those patients going from pillar to post, looking for a diagnosis for something in the mouth for which they are already being treated on their limbs otherwise, but they've just not thought that it is related to the same. And unfortunately, the dermatologists don't even bother to look in the mouth. So that is something that you approach dermatologists and get into a practice with a dermat, you will be in a great place. So the future is not bleak, really. It's pretty bright. It's bright enough for you to have to wear shades. And I will just put some, these are some, very, very prominent figures in Indian oral pathology, starting from the dawn of oral pathology here, D.K. Daftari to Dr. S.R. Prabhu and Vinay Hazare, Dr. Kannan, Ranganathan, Raghu Radhakrishnan from Manipal, Mandana Donahue, who runs the Asian Academy of Oral Pathology, and she has a very, very active YouTube channel on oral pathology out of Belgaum. And again, she is not attached to any institution. She does this on her own. So there is a lot of these are people who have put Indian oral pathology on the international map. they with their global connections, with with the amount of research that they've done and published, as well as people like Dr. Ranganathan and Raghu having gone abroad and studied, they've made more connections, and they've really taken oral pathology out of its infancy in India to a very recognized field in the international circuit. So, I mean, you have something to look forward to if you're going to get into oral pathology. And if you just take a look at what is available out there, there were about 560 MBA seats in oral pathology, out of 174 dental colleges, that were offering these seats in 2018. And again, like I've been telling you, this is the foundation on which everything is built. All right, it's unique. It's the confluence of all the basic sciences and clinical dentistry. You will learn hematology, biochemistry, immunology, serology, microbiology, cardiology. I mean, every aspect of dentistry and every part of the therapeutics that we provide has a foundation in oral pathology. So I mean, you should not ever feel that there is not there is no clinical scope for oral pathology, because all the clinical branches, so-called clinical branches, are built on this foundation. You have fellowship programs after your MDS in oral pathology. You have programs in Tamil Nadu MGR University, that is the TNGDC in forensic odontology. Varda offers a fellowship in immunohistochemistry. Savita offers cytopathology and orofacial pain. Malabar Cancer Center in Talasheri gives you a fellowship in head and neck pathology, which again is all about oncopathology. D.Y. Patil in Pune gives you forensics. Apart from this, there are several other. I've just enumerated a few. So if you're thinking about what next after doing an MDS in oral path, you have multiple avenues to super specialize. To look at, there are some people. There are several people who are regular police consultants as forensic odontologists. So you have the ability to super specialize and get attached to those sort of institutions which require those services. And there is work involved. It is not for everybody, because this is not a branch in dentistry which you join with the expectation of lucre, right? That is not what this is about. This is about this is not something that is going to get you pots of money. So if for that and I will suggest this, and I will say this over and over again, because this was told to me by who I consider my biggest mentor when I was doing my master's in Nair Hospital, Dr. Ravi Shetty, and he would repeat this in all those years that we knew each other till he passed away about 17 years ago, was that aisi jagah baith ki koi na kahe ut, and that is in your own practice, right? So there's no dental college, no other place where you can live life on your own terms. And so I will recommend that each one of you, if you have the ability to do that, run your own practice. Even if it is not dental practice, run your own oral path practice. At this point in time, between oral pathologists, oral medicine and radiology graduates, and community dentistry graduates, and unfortunately, this is the sad truth, these three specialties are kind of lost because there is a glut of jobs. There are not enough academic jobs. There are not enough opportunities out there for you to get into an organization where you can work and earn a living. And I suggest this to all young pathologists who come to me, that why don't you get together with some of your oral medicine and community dentistry graduates. So you can start a diagnostic center which does radiology, which does clinical exams, which does histopathology, clinical pathology, that is all your hematology, serology, etc. And at the same time does intervention programs. And you will find that if you're able to get together with these specialists and make a group practice out of it, there is money to be made again, right? It will not be something that does not reward you financially as well. So I will encourage people to get into. I mean, 25 years ago, I chose this path. I have my microscope there. I do my histopathology, surgical pathology reporting from there, and I do my clinical dentistry back here. And I mean, you have the ability now of thinking bigger and starting these kind of centers where all these needs are addressed under one roof, and that is a private practice, another place where you can ensconce yourself and nobody can shake you. You have PhD programs in oral pathology. There are at least 15 universities right now in India which are offering PhD programs. So there is a scope to get into research and think. Now, this also means that you have to be able to write proposals for getting funding, because without funding, you will not be able to do research. And there are certain organizations which offer funding. ICMR is one of them, and so is so do you get funding from universities like Rajiv Gandhi University of Health Sciences. So there is a lot of scope for doing research and pursuing PhD, a postdoctoral degree in oral pathology. This is as far as India goes. When you cross you cross our borders, the opportunities are endless, but it comes with the burden of the finances that will be involved in going abroad. I don't want to, I'm a realist. So when I'm telling you all this, I want those 5 people who may be interested in oral pathology to think about pathology as a future and get into it wholeheartedly, knowing that your presence in the field of oral pathology will make an impact on some people's lives. Having said that, you are, like I said, the sky is the limit. You can fly as high as you like, and you just need to be careful that you don't take the flight of Icarus straight to the sun. Your wings may melt at some point. So having said that, thank you very much again for having me here. More than anything else, I would like to take some questions if there are, because I think that's more important than me just rattling on like I love the sound of my own voice. Thank you.
Thank you, sir. As there are no questions and answers in the box, sir.
All right.
Once we receive it, we'll mail you, sir. Right. Thank you, sir, for your wonderful and informative presentation, sir. And thank you for giving us very knowledgeable words and openings on oral pathology to our participants. And we really appreciate your time with us, sir. Thank you, sir.
Thank you.
We request you to kindly receive our token of appreciation from the organizing committee in the form of certificate.
Thank you so much.
Thank you, sir. Over to you, Soumya.
Thank you, sir. Thank you, Dr. Deepa.